Hey everyone, we're live. This is Michelle. Nice to have you all here. I've only done a couple live videos, so I have no idea what we're doing. So hopefully some people chime in and we can have a good little conversation.
Okay, good.
We're here with Michelle. She's one of our patients here at AFI, and she is wonderful. And I'm excited to chat with her and kind of show you guys a little bit more about what we do here, what I do since I'm a solo practitioner. And kind of give her experience of what she's gone through and hopefully help more people out there know what the options are. We're going to name this episode of a new series called, what did I say we're going to call it?
What your surgeon won't tell you.
There you go. Nothing against surgeons. I have friends that are surgeons. I think they're geniuses. But a lot of times, I mean, I know what I know. I don't know what I don't know. And I think sometimes we can get pigeonholed into dealing with only what someone knows. And so Michelle's going to kind of share her experience of what her surgeon explained to her, and then what she was able to accomplish outside of medical treatment. So let's jump into it.
Okay, so hello, thank you very much. I had actually on both of my knees 7 years ago 2 meniscectomies, and this one was actually the worst one, and it's been better ever since. And then my right knee, I had a lateral meniscectomy, developed into severe cartilage loss, and has degenerated, severe arthritis in the knee, and kept going back to my surgeon, and I was getting viscous supplementation, which actually did help quite a bit, but it got to the point where I could not do my normal activities. So I ride a lot of motorcycles, I mountain bike, but to the point where I could not even strength train the leg. It just wouldn't take the weight, and the muscles were shut off. There was just nothing there. And so my surgeon, going back and complaining and trying to find solutions, was pretty much just waiting to replace it, and that just continue to beat it up and then we'll just replace it. But I could tell there were things in the joint that needed worked out, that could be worked out to get the muscles firing again so where I could do what I needed to do. And that is where, and I joined Berserker. My husband and I joined Berserker, and I was going to go see Luke if we joined the gym, because everything I was doing wasn't working. And I don't know if you want me to go on or...
Well, I'll have a question. So like you said, so 7 years ago was the bilateral partial meniscectomy.
Mm-hmm.
And then how long after did you start feeling the like just wear and tear? Like, you know, when did you start feeling like, man, I can't load this anymore? Like, I can't do exercise, I can't ride. Like, how long after that?
The knee had never really been great since surgery. I would say probably for almost a year, it started getting to the point where I couldn't load it at all. And even simple movements, cleaning the house, you know, working on the bikes in the garage, just very simple movements I couldn't do anymore. Go back to my surgeon, well, now I can't do this. Yeah, you're not going to like how the arthritis does progress, so they're correct about that, but you're not going to like how it progresses. Just, you know, it is what it is. You're just not going to be able to do those things anymore, and just basically wait to replace it. So I'd say a good almost year that I just was not motivated to lift. I couldn't lift. Every time I would try, it just was painful, you know, it just was really painful. So
got it. And that makes sense. So because when I saw her for the first evaluation, you remember that quad, flexor quad, show everyone your boom. So you can see her VMO, her intermedius and rectus, and then her lateralis. Like, this wasn't there. It was like femur, some tissue and skin, right? Like, there wasn't a lot going on.
I had an old lady leg.
An old lady leg.
And this one was taking all the load.
Right? And it was super inhibited, right? And if you have knee pain, you might have experienced this if you've had surgery. I had a cartilage transplant on this side, and I remember going through a similar thing.
Yeah. I asked about that. The cartilage is so jagged. I'm not a candidate for anything. It's so far progressed that just...
Yeah, so it wasn't a salvage procedure.
Nothing.
Like, it was replacement or nothing.
Mm-hmm.
And so when she came in, it was like I said, super atrophied. Range of motion was decent.
Mm-hmm.
Like, she had what you could say full normal range of motion, but compared to this side, what were some mobility issues? Like you had said, like kneeling, right? You couldn't kneel down on your knees and definitely couldn't sit back.
I literally could not even kneel on this knee. There was just so much around the kneecap and everything, like just kneeling was painful.
Yeah.
I haven't been able to get into a, you know, super hyper flex position like sitting Indian style. I hadn't been able to do that in 7 years since I had the meniscectomy. Just couldn't do that. So definitely squatting down, all those types of movements. Now your one-legged squat.
Yeah. Yeah. First they would try to have her. I wanted to test it. I wanted to see where you're at. It didn't feel great. So.
Yeah, just did not like to do anything on the ground.
Yeah.
It was very painful.
So that's the mobility stuff, and then you kind of mentioned before. What are the like outdoor activities? She's pretty intense, guys. She just won a medal, by the way. I shouldn't have spoiled this.
I did, yes.
But, so go back a few months ago, or anyway, sorry. Let's share what activities you like to do.
So I spend my life pretty much on 2 wheels. We ride a lot of motorcycles, but we ride off-road bikes, but we also ride trials motorcycles. And trials motorcycles, you are constantly in that flex position with your knees, like your knees, movement of your knees, sticking your knee out to make turns. You have to, and it has to happen quick, of taking that load. And it was to the point where, and Luke pointed this out, because I couldn't figure out what was going on, your brain shuts off certain movements, but I was still asking my body to do these movements. So rather than the muscles taking the load, it's going to all these other tissues that shouldn't take it. So I do that activity. I mountain bike. Mountain biking, there was inhibition in the full stroke on this leg. You know, I would have to get on the brakes when I didn't want to, just because the leg wouldn't come around. At the top of the kneecap, it just was inhibited. So that type of movement, and then of course strength training in the gym. Doing squats, doing lunges, you know, deadlifts, all those types of things. So particularly riding, when all you're thinking about is your knee, which is not what you should be thinking about when you're trying to do these things. And now I'm to the point where I literally don't even, it is not even remotely have to think about it. You know, and I'm not getting those sharp, unexpected pains when I do my spectacular things sometimes. There's lots of fails. There's lots of fails. Yes, and I did just win a medal. I had a lot of trials events.
So good. So you can see it was heavily impacting her life, your life, in so many different areas. You said from just home, easy domestic activities like sweeping the floor shouldn't be a killing event, but also trials, riding, mountain biking, all those different things.
Right.
So. Okay, so then let's go into our time together. So you kind of knew something, like it didn't, the pieces didn't really fit together, right? You felt like, okay, there's got to be some other tissue. It's not just the joint arthritis that was causing your pain. And so we kind of chatted about that, and in our examination we found like the joint motion was actually good. When someone really needs a joint replacement, and we've talked about, we see it like it's stiff. The arthritis has caused that capsule just to tighten up. Obviously, there's a continuum of arthritis. It's not just like, oh, you have the cold. It's arthritis is a continuum of a diagnosis. And so she had good mobility. I should say decent mobility. I'm like, I don't think it needs a joint replacement. I thought there was like tissue involvement that was causing inappropriate stresses and pain and causing that inhibition. And so, as far as treatment goes, I did a ton of soft tissue work on the distal quad. So a lot of people talk about the IT band, right? So you have her IT band is like crazy tight. I'm not allowed to tell people some
that's the thing.
So her fascia around her quad like became her shock absorber. Like every time she would squat, or like on her trials bike. For those of you that don't know a trials bike, I didn't know what trials bike was. She educated me. It's basically riding a motorcycle with no seat. It doesn't have anything there. So you're bouncing and using your legs the whole time, right?
Yes.
And so her quad, when she came in, again, was like atrophied. And so instead of her quad absorbing that shock and whatnot, it had developed into these like fascial connective tissue thickenings around like the distal end of the quadricep. Her IT band, tensed up because it was taking a lot of that load. And it was just very painful for her. And so we kind of started there, right? Just working on that tissue, getting it more mobile, and then hitting some isolated quadricep, even like some easy stuff with like some, I call them generic quad exercises of like short arm. Remember I had you like a few pounds like locking the knee out and lifting it, and it was like
we couldn't find like it, and that's the great thing is I think that appointment went like a half an hour over time because it was so bad we couldn't even find a quad exercise. You finally found one that that wasn't so painful.
Yes.
I mean, it was so bad, like if I even just like moved my foot like this, it irritated my knee. It was that. I mean, it was just all red here, the skin. It was so irritated. So just finding a quad exercise that I could even do. That's how bad it was.
Yeah. And you did. You found it. So we did some different like short motion, big motion, isometrics. So she started getting it, and we did a lot of work around the joint as far as we call them joint mobilizations. So just quickly with arthritis, right? We think about the joint degeneration and stuff, but the capsule around the joint, just so folks listening or if we want to repost this or whatever, if they have your similar issue, they can understand. The capsule is like ligaments around the joint, right? And that gets thick and inflamed repetitively over 7 years like you had. And so that tissue also becomes painful, like you said, when you kneel and stuff. And so we didn't change anything. We didn't give her more cartilage. We didn't regrow her meniscus. But we gave those tissues more extensibility, more flexibility. And then progressively...
Like even doing this, I couldn't do this.
You can, just whipping your knee back. Tell us, let's see, so what did you do outside of our... Well, first of all, what do you feel like has helped the most with your experience here, training? What do you feel has helped?
Well, it was kind of a chicken and egg thing.
Yeah.
The manual therapy, that was very painful.
Yes.
But I had to get that sorted out to be able to then start strength training. So I would say that your ability to painfully work that stuff out then allowed me to be able to work the knee out more. So really doing the quad exercises, being able to get on the bike, and then being able to really stretch everything around the knee helped tremendously. So just in the gym as much as I can, on the bike, but then still doing my other activities. I probably tested it a little more than I should have tested it. Yeah. But then just really doing, and I had to do even more of the strength training.
Yeah.
I mean, probably 4 or 5 days a week in the gym, and then just a lot of stretching.
Got it.
And then that manual therapy really helped.
So it was cool to see because you worked your butt off to get that, right?
Yeah, and I'm still working.
She's
There's
still
still
working.
work to
It's
do.
not 100% done.
No.
And so now, what are you able to do that you couldn't do, 2.5 months ago or whatever it was?
Oh.
Right?
Well, I mean, I can do the leg extension now. I can start slowly getting back into some squatting. I can do that. I can sit cross-legged without having to carefully fold I can just sit that way now. I can get it, stretched more, and when it's really warmed up, I can actually sit back on my heels, which is absolutely amazing. I've never been able to do that. I can ride now. I can mountain bike. There's no inhibition in that full range of motion. And then when I'm riding my trials bike, I'm not thinking about my knee. Like it's not in the back of my mind, thinking about it, and then, motion's getting shut off. The other bikes that we ride, you go from a bent sitting position to standing quite a bit. So that's not, there'll be a little soreness just because it's worked on so much, but it's not I don't feel that weak where it wants to just collapse.
Awesome.
The strength is getting there to where I can do that.
That's so good. And it's awesome that you're already feeling this benefit because you can, I don't know if you can see in the video, but if you want to tighten up both quads, so there's still quite a bit of size, like muscle atrophy, right, going on. And so therefore the strength output from this quad compared to this quad, it's not the same, but still you already feel a lot better.
Poor leg has been doing so much
all
more
the
work.
But it's so cool that you've already been able to increase, many times what you were able to do. And like you said, a lot of it is when we have arthritis in that joint, it's not just the bony and cartilage surfaces that the issue is in, but it's the connective tissue around that becomes all screwed up, right? And so once you got that mobile and less irritated, and something I want to point out is like, we didn't wait for all of her pain to go away before you did stuff, right? No. So if we did that, you'd still be waiting, like you still have a little bit of discomfort and stuff. So a lot of times I feel like people are afraid of the pain, like, oh, if I do this, I'm gonna hurt it. And so as soon as you were able to do a little bit more, you did more, right?
Mhm.
As soon as you upped it and upped it and upped it, and so your body's been able to adapt, I feel like, right? Instead of waiting, okay, it's not, I still have some pain, okay, maybe I won't do this. Like, you were constantly, you use the word testing it, which I think is good. You test it, you didn't over test it.
It'll tell me, like,
Yeah.
basically when it's, I'll get weakness if it's too much. I'll feel something and it'll be weak, but then there'll be other times where the strength still stays there. You just have to, because it's worked on so much that I can still, and it's not puffy and swollen or anything showing signs of
like
that
real
it's
tissue
really
irritation.
angry.
Yeah.
Right.
So there's some symptoms and then signs. Like, symptoms are like, ouch, this hurts. Ooh, this is tight. And then other signs are like, it's swollen, it's red, it's
Yes, which is what it was before.
Right. So that's awesome. So Michelle did an awesome job at like being able to self-analyze, right, and self-assess, and then push close to your limit. And it took a lot of hard work on your side.
Right.
A lot of work on my hands, but
which is not done yet.
It's not done. We still got more work to do.
There's still a few things.
Yeah, but that's so awesome. And so I hope that if anyone's watching this live or when we repost it, if you have any issues similar to that, where it's like, dude, I've tried this, that, and the other.
Just frustrated, totally at a loss.
Yeah. Give us a call. We'll chat about your stuff. We'll do an initial evaluation, because honestly, we don't know until we look at it, right? Because we chatted a little bit in the gym.
Yes.
And then
I kept bugging you while you were trying to work out.
I was doing deadlifts. I was like, but it was good. Like, that's why I'm here, right? To be able to help people.
Right.
And then once we got you in and we were able to see what was going on, then we were able to really say, okay, this is what I think it looks like. This is what I think we need to do, and where we can get to. And honestly, I didn't know exactly where you would be.
Right.
I knew we could get you better, but I didn't know how much. Like, would you be able to trail ride pain-free? Would you be able to mountain bike pain-free? I'm not 100% sure because of the underlying, joint degeneration stuff.
Right.
But lots of times things can get even better than one thinks if you work it hard and do it in the right way. Something that's a little bit different about how we do things. We work one-on-one every time, right? So we don't have any kind of aides or assistants that are doing the patient care. So every second that a patient's here, we get to work together.
Mm-hmm.
So it's fully, we're working on the, figuring out the diagnosis, figuring out the treatment dosage, I like to call it, like how many, sets and reps, how much loading, the strength and conditioning part of things, the manual therapy. So everything is very much focused right into what you need as a patient. And so that's different than if you go to another high volume clinic, right, where you're being seen with 3 or 4 other people in the same hour and it's just getting milled through. So if you've had that experience where you're getting milled through a physical therapy place, if a physician has told you that there's nothing else you can do, I would argue with that lovingly. But yeah, like I said, nothing against other practitioners, other surgeons. Surgeons do things that I can't do, and a lot of times there might come down the road a time where you need that, and awesome. But I think that there are a lot of things that could be done for people that aren't being done, and so I'm here to do that. And I wanted to show you guys that Michelle is a great example of that.
Yep.
Anything else you want to tell the folks in Cyberland?
You just got to keep fighting. If you really want it, you just got to fight for it and hold off any more invasive procedures, like that you don't have to have done right away. So,
cool.
Highly recommend.
Thank you. Boom.
There you go.